What does Medicare cost? That's a tricky question without a straightforward answer. We'll explain today on Elevate Wealth. Hello and welcome. I'm Deanne Rosso with Elevate Wealth Advisory, and a question that we get a lot is, what is Medicare going to cost me? And so today I'm here with one of our wealth advisors and Director of Wealth Advice, Gary Stoller. Hey, Gary.
Hello.
So Gary, this, again, question we get a lot. So what does Medicare cost?
Great question. Let's break it down.
Okay.
All right, so you have Medicare A for hospitals and B for doctor's offices. So Medicare A, essentially throughout working in your career, you've kind of paid into that.
Okay.
And so there's great news here, which there's zero premium for Medicare Part A. There's no cost to that. There's a built-in deductible, about $1,700. Part B is a little bit more complicated.
Okay.
So this is going to depend on your income, specifically your modified adjusted gross income. For married filing joint, I'll go ahead and explain the brackets here. If someone is married filing joint and their modified adjusted gross is $212,000 or less, then their Part B premium is $185 a month.
Okay.
Per person who is on Medicare Part B.
Okay.
If their income is a little higher, between $212 and $266, then that premium is $259 a month.
Okay.
If it's $266 to $334, the premium is $370. If it's $334 to $400, it's $480. If it's $400 to $750, it's about $591. And if you're making over $750,000, then your premium is $628 a month.
Okay, so we're talking about original Medicare, Part A and Part B. Part A is free.
Yes.
Part B is those brackets you just went through,
Yes.
depending on your modified adjusted gross income. The look back for that is also 2 years ago, right?
Yes. So the way to think about that is, how do they know how much money you're making this year? Well, you don't even know how much money you're making this year. You haven't done your taxes yet.
Right.
And so because it starts the beginning of the calendar year in January, how do they know what you made last year on January 1st? Well, you still don't know.
Right.
Because you haven't done your taxes yet. But they do know the year before. So that is the figure that they go off of.
Okay, great. So go back, look at your modified adjusted gross income on your tax return from 2 years prior,
Yep.
and that will tell you what your Medicare, or your original Medicare Part B premium should be for
You
this
got
year.
it.
Okay.
You got it.
So now let's shift gears to Medicare Advantage.
Yes. So Medicare Advantage is not a federal distributed benefit. It is private insurance companies. And so the costs are going to vary there as the plans and benefits vary from one company to the next and from one plan to the next. So you may pay up to $50 or $100 a month for a plan there, or as low as $0 a month. So what you got to watch out for is your co-pays, your deductibles, your co-insurance, and especially your networks.
Right.
Which doctors are in your network? Is your doctor in network? So there's a lot of variables there with Medicare Advantage. They also may include prescription drugs or possibly dental, vision, or hearing coverage like that. So if you're on original Medicare A and B, can you go out and get your own prescription drug plan? And the answer is yes.
Okay.
So you're going to buy that from a private insurance company, and those plans and costs are going to vary. And so you need to look at what prescription drugs you're on and which plan is going to benefit you the most.
Right.
So also you can go out and buy your own dental, vision, and hearing plan. So if you're on just A and B, you can supplement that with dental, vision, hearing, and prescription drug plans. And then the last thing I want to mention is an actual Medicare supplement plan. Okay. Also called Medigap. Like I said, there's a $1,700 deductible for hospitals and 20% co-insurance for doctor's offices. And a Medigap policy will cover all of that and close off that gap. If you do a plan G, as in Georgia, then you'll have everything covered except for about a $240 deductible once a year. And when you're age 65, aging into Medicare, then that plan should cost maybe around $120 a month, maybe $130, $140. And that cost will go up slightly each year.
Okay.
Yeah.
So lots to consider, but to summarize, on original Medicare, Part A is free as long as you've paid into the system for that Part A over your working years. Part B has a premium that's based on your modified adjusted gross income.
Correct.
You can add a private drug plan. You should add a supplement. So all those things bundled together are what you will pay for your original Medicare.
Yeah, you can maybe assume somewhere around $300 to
Okay.
be safe if you're aging into age 65.
Okay. And then Medicare Advantage plans have a cost associated with them based on the insurer that you choose for that plan. But pretty much everything is kind of bundled into that solution.
Correct.
And so there can be some cost differences. It seems like Medicare Advantage plans are typically less expensive than your, all of your supplements and things that go with the original Medicare.
Yep.
But cost is not the only factor to consider when you
Correct.
consider which way to go.
Right.
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 Okay.
So doctors being in network again is usually
Yes.
the biggest one that people want to consider.
Right. And so we made a video about that last week. Go back and check that out if you're interested in who qualifies for Medicare and the differences between Medicare Advantage and original Medicare. But from a cost perspective, that's something certainly that's important to consider as well, and all the different parts that go into paying that premium.
Correct.
Awesome. Well, thank you, Gary, for joining me today and explaining all of that wonderful information. And figuring out your retirement income is important, but figuring out your costs in retirement is just as important, especially those healthcare costs that can rise as you age. So if you need help with this, or if you'd like to discuss your situation and how Medicare and or healthcare costs apply to you, we are here to help. Visit us at elevate-wealth.com. Click Let's Talk. And we would hope to see you around the office soon. Thank you for tuning in, for watching, for listening, and we'll see you at the next video.